A breakthrough spine surgery is helping student athletes, and it's happening right here in the Bay Area at San Ramon Medical Center. It's called an endoscopic pars fracture repair, and it's used to treat a specific type of fracture in the lower back caused by overuse. Studies suggest it is the cause of low back pain in nearly half of all adolescent athletes. Now, the surgery is groundbreaking for a couple of reasons. It's endoscopic, a minimally invasive type of surgery that uses a thin tube with a camera to view and operate, which means small scar, less pain, shorter recovery time, getting athletes back in the game faster. Now, several young athletes have undergone this new technique right here in the Bay Area in the last 6 months. And joining me now is Dr. Saqib Hasan, who performed those surgeries. He is the first fellowship-trained endoscopic spine surgeon in the United States. Thank you, Hasan, for being with us. So most of us usually think about back pain and surgery with, middle-aged or older folks, but young athletes can suffer from this too. Is that really common? And how do you get a pars fracture?
Well, as you mentioned before, about 50% of athletes who present with low back pain can have what we call a pars fracture or spondylolysis. And the best way to kind of illustrate it is a model here. So if you look at the spine, a lot of these athletes do a lot of repetitive hyperextension. And what can happen with repetitive hyperextension is you can actually have a stress reaction in this bone here called the pars. And over time, with continued playing, you can actually have a break, and that can actually lead to gapping of the fracture. And then if left untreated and you don't take care of your core, you can actually have slipping forward of the vertebrae, which is called spondylolisthesis, or colloquially called the slip disc.
So, Dr. Hasan, most parents are hesitant to agree to any type of surgery if that's brought up for a student. But this surgery minimizes the risks, and it changes the outlook for high-level student athletes who want to get back in the game and continue their sports. Is that correct? How?
Yeah, so I like to think of surgery kind of like medicine conceptually. When you think of adults, you give them a certain dose of medicine, but you wouldn't give that same dose to a child. When I think of surgery, you can think of surgery as being in doses. Well, why would we give the same type of surgery to an adult to a child? And that's a concept behind leveraging some of these new technologies like an endoscope and navigation, is that we can lessen the dose of surgery so the surgery can actually be more palatable for the patient and their family. I think that's the big breakthrough here, is that leveraging technologies that can minimize the trauma and recovery time for some of these young patients.
Yeah, so what is the recovery time compared to traditional surgery with this? And I know that I understand that you get a very small scar instead of having to open up the back. Is that correct?
Yeah, so traditionally, like we talk about doses of medicine and doses of surgery, traditional spine surgery is typically done with an open incision. And the idea behind open incision is that you have to use your eyes to be able to see where the problem is and fix it. Well, when we leverage a technology like a camera, the camera is our eye, and it allows us to be more precise and minimize muscular damage and collateral damage that can occur with surgery.
All right, that sounds impressive. So recovery is quick. And what is your best advice that you can give to athletes out there to try to protect their back to start with?
Well, I think the biggest thing is if you do have some degree of back pain and you're an athlete like a gymnast or a football lineman who has repetitive hyperextension forces on your back, I mean, you should not ignore the back pain that you have, and you shouldn't play through it. That's number one. And then you should obviously see your doctor in case the back pain persists. And there's a lot of different imaging modalities we can do to determine whether or not you have that fracture. But bottom line, to prevent it, you have to make sure that you have a well-balanced body. And that has to do a lot with stretching to make sure the muscles are in correct form so you don't have too much tension on your back. For example, the hamstring. So I think hamstring stretching is very important. Having a good core and having good posture are all just basic staples of having a healthy back.
That sounds fantastic. All right, Dr. Hasan, thank you so much for being with us and explaining the procedure.
Thanks for having me.
All right, also tonight.